How is suicide prevented? As with any physical health issue, we need to know what to look for, what to say, and what to do. What to look for would be those warning signs. What to say, how to intervene, and what to do, how to refer an individual to help or treatment. Let's look at both risk factors and protective factors. By identifying potential risk factors and strengthening or building protective factors, we can prevent suicide. Risk factors are characteristics that make it more likely that an individual will consider, attempt, or die by suicide. Protective factors are characteristics that make it less likely that an individual will consider, attempt, or die by suicide. Like many health and public health issues, there are factors that increase and decrease risk of suicide attempts and death. We often hear about risk factors for diseases. %90 of those who take their own life have a diagnosable and treatable mental health disorder and/or substance abuse disorder. However, not everyone with a mental health issue, such as depression, is at risk of suicide, but are at more risk than the general population. Shame and stigma prevent people from getting mental health treatment. It also prevents people from reaching out when they are thinking of suicide. This slide provides some examples of risk factors. Prior suicide attempts, alcohol and drug abuse, mood and anxiety disorders, access to a means to kill oneself, self-injury, isolation, low self-esteem, a history of abuse, and depression. Some things we can do to lessen the risks factors include engaging them in social activities. This can be an alternative to alcohol or substance abuse. We can promote or encourage them to seek help. We can provide mental health resources. We can address issues that increase their risk, such as bullying, substance use, and violence. And we can reduce their access to lethal means or weapons. Some groups are at higher risk for suicide. Students who identify as lesbian, gay, bisexual, transgender, or questioning are at the highest level of risk. They are 5 times more likely to attempt suicide than their straight peers. They are also at higher risk for depression, bullying, and isolation from peers. Other groups include Latino youth, American Indians, rural youth who may not have access to mental health services, and those with a history of abuse and/or trauma. Protective factors can help with mental wellness. Some examples include having effective mental health care, being connected to individuals, to family, and to the community, having good problem-solving skills, having contact with caring adults, connections to religious and cultural beliefs, and having a positive self-esteem. We can strengthen or build upon protective factors by ensuring youth have access to effective mental health services. We can promote the connection to family, community programming, faith, or sports activities. We can teach life skills by improving their problem solving and coping skills. And lastly, building relationships. Taking the time to connect with loved ones can be one of the most powerful protective factors. It is important to be aware of and act on warning signs for suicide. Most people who are at risk for suicide will not seek help on their own. Research shows that the majority of those who attempt suicide give some warning signs. These warning signs may be verbal statements or changes in their behavior. Talking, writing, or texting about wanting to die or kill oneself is a big warning sign. Also, seeking means or looking for a way to kill oneself. Talking about feeling hopeless or not having a reason to live. Risk factors can be magnified if there's a recent painful event loss or unwanted change in their life, especially if it is humiliating or accompanies shame. Other warning signs include talking about feeling trapped or in unbearable pain, talking about being a burden to others, increasing the use of alcohol or drugs, acting anxious, agitated, or behaving recklessly or impulsively, changes in sleep, sleeping too little or too much, being withdrawn or feeling isolated from others, showing rage, talking about seeking revenge, and displaying extreme mood swings. Because suicide is about life and death, trust your instincts. It is better to err on the side of caution than to miss an opportunity to save a life. How will I really know if someone's thinking about taking their life? Always trust your instincts. Do what feels right. Remember to never leave a person alone who is thinking about suicide. Physically connect them to support or help.